President Trump is looking to reduce prescription drug prices with a new executive order.
But critics question its effectiveness. They call the order little more than a request to drug makers. And WGN's Christine Flores joins us with more. Christine.
Oh, good evening, Ray and Micah. It's being called the most favored nation policy. The president says prices could be based off what other nations pay. It'll target prescriptions covered by Medicare, Medicaid, and private insurance. Popular weight loss drugs are also expected to be on the list.
For the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America.
President Donald Trump laid out the plan for his executive order, which he claims will lower prices for prescription drugs by more than 59%.
They've been justifying this crap for years. They said, oh, it's research and development. Well, I said, well, research and development, other countries should pay research and development too. It's for their benefit.
This isn't the first time we're seeing this kind of an order presented. During Trump's first term, he shared a similar order, but it failed after it was blocked by a federal judge. Today's order is described as a more aggressive version.
Whoever is paying the lowest price, we will look at that price and we will say that's the price we're going to pay. Most favored nations. That's what it is.
Its goal is to facilitate direct sale at the most favored price by cutting out the middlemen, also known as pharmacy benefit managers, who negotiate prices on behalf of insurers and companies.
If the Europeans raise the price of their drugs by just 20%, that is $10 trillion. That can be spent on innovation, and the health of all people all across the globe is going to increase, because we're going to have better products.
Health and Human Services Secretary Robert F. Kennedy Jr. has 30 days to come up with price-cutting goals, thus kicking off rounds of negotiations between him and the drug industry. Meanwhile, drug makers say this will threaten their profits, impacting their research to develop new drugs. Stephen Ubel, president and CEO of Pharma, said in a statement, "Importing foreign prices will cut billions of dollars for Medicare with no guarantee that it helps patients or improves their access to medicines. It jeopardizes the hundreds of billions our member companies are planning to invest in America, making us more reliant on China for innovative medicines."
There are still many questions around how the administration will implement the policy. There is no clear timeline as to how fast Americans will see lower prices or what authority the U.S. government has when it comes to directing drug prices in other countries. Back to you guys.